Ladies and gentlemen, the last year has seen people face challenges that no one anticipated. When the COVID pandemic hit, people had to decide how they would go about getting consultations if they felt any symptoms of illness or had preconditions. While entire sectors had to briefly shut down and figure out how they would continue to operate, one sector had absolutely no choice in the matter. Healthcare not only had to continue to operate, but it had to expand, it had to cater to a perhaps larger need than it had foreseen, and it had to do this under frankly dangerous situations. Countless doctors perished while helping people battle COVID. Heroes, all of them. Amid all this, however, India responded, the healthcare sector really responded. We went from a situation where we didn't have PPEs to a place where we are the biggest manufacturers of not only vaccines, but also regular drugs, PPEs, and also ventilators. The role of startups in this cannot be underplayed. Now, India has always been a fertile ground for startups in the telemedicine and healthcare spaces and the health tech space as well. But now we have the pleasure of being joined by the CEO and co-founder of a company that has expanded even beyond hitherto known frontiers. Mr. Prasad Kompalli, the founder and CEO of MFine, is with us today. And MFine, ladies and gentlemen, provides all the regular services that you would expect from a new age health tech startup, but it also provides just a little bit more. MFine is empowering people by turning their mobile phones into diagnostic tools. I would like Mr. Prasad Kompalli now, over the course of this interview, to tell us a lot more about the range of services that it offers, and then we will ask him about how it is defining tech and health tech in new domains. Mr. Prasad Kompalli, thanks so much for joining us, sir.
Thank you. Thank you for having me today.
Why don't you start by telling all our audiences exactly what services MFine provides to them and how they can avail of it?
Yeah, so for anybody in India visiting a doctor when they are not well, or they have a chronic condition like a diabetes or a thyroid problem, etc., regularly visiting a doctor and getting better is a big ordeal, right? I mean, you cannot, get the appointment immediately. Always the doctor is, few dozens of kilometers and a few hours away, right? If not days, right? That is the problem we really wanted to solve. When we started with MFine 3 to 4 years ago, the service itself started in 2018. By a bunch of technology entrepreneurs, myself, Ashutosh, and a couple of others who joined us. And we expanded quickly the team. And the idea was fundamentally that if we can make it very easy for people to get timely healthcare, right? Be it talking to a doctor and doing consultation, be it getting medicines delivered at home, that the medicines that the doctor has prescribed, or even do some of the blood tests and other tests that the doctor has prescribed, right? Or anyway, regularly what you do for managing your conditions like diabetes and other chronic conditions. So that was the fundamental idea, and we saw the opportunity that we can develop this in India, for India, in a with unique strengths of India, right? So we saw the opportunity that there are 400 million smartphone users in the country, soon to be 750 million or so. So connectivity is getting to reach every place in the country thanks to Digital India kind of initiatives, and everybody is accessing many services on this, on internet, on smartphones, and we saw the opportunity that a unique model can be developed where just from a mobile app, people can reach out to any healthcare service. As I said, like a doctor consultation, like a chronic care management of their chronic conditions, or medicine delivery, or diagnostic test organization. Either it's a primary care or it's all the way to even tertiary care to reach the experts and join a get a surgery done, etc. Right? So I think that's what we have built in the form of MFine. It's been an exhilarating journey last 3 years. People can simply now visiting a hospital or just getting get a control of your health is simply a tap on the mobile phone. That's what we have done, right? Open the app immediately across 35 odd specialties. Doctors are there all the time, from very early in the morning to late in the night. Any point in time, you can reach out. Any point in time, you can even book a health check, and somebody will come home and take your blood sample and then give you a completely digital report that the doctor can look at it and then instantly get an idea of what might be the ailment and what might be the medication plan one needs to follow. So it made it very, very simple. And over the last 3 years, we have served more than nearly 2 million people in India across the length and breadth of the country. As I said, across 35 odd specialities, nearly 600 hospitals are serving patients on MFine via digital means. 400 diagnostic labs are available as well. So people are really availing these services. Only when we saw that people are using it extensively across from the nooks and corners of the country, from the east to west, south to north frontiers, we realized that such a dire need of healthcare access is there, particularly in this country where specialist doctors especially are quite a small number. One specialist doctor for every 5,500 people is extremely challenging to get to a good specialist trusted doctor or an institution. That's what we are democratizing, and we realize that when you provide that simplified access, automatically it leads to better health outcomes. There are umpteen number of cases on MFine where people are experiencing their chronic condition management, a reduction of medication, instant access from a pediatrician access at 9 in the night on a Sunday to an orthopedician access from corner of the country in a second-tier town to a specialist doctor in towns in cities like Hyderabad or Bangalore or Delhi, etc. So highly qualified, highly experienced doctors. So we really are seeing that better and better outcomes can be delivered, and we see that this is a kind of inevitability that technology has to augment the capacity that the healthcare systems have in this country, and by that approach, we can reach more and more people. We can really make India a better and a healthy place. That's the fundamental idea of MFine and the vision of MFine that we're working towards.
Right. Thank you so much for telling us this. Now, just for our audience's benefit, because the health tech space has been expanding for so long, we know that people are familiar with the concept that with a phone and a video connection, you can speak to a doctor telephonically and with an AV link. You can perhaps book an appointment if you want. But there are certain new services that have been pioneered and that MFine is a champion of. For instance, if they were to go right now on the website, they would be able to schedule a pickup of samples to get tested for many dozens of ailments at one of the top diagnostic centers in the country. You have tied up with many of them. Then there are the AI-powered tools that the MFine service offers, such as, for instance, you talk about things like gait analysis. You talk about things like heart health monitoring. Basically, MFine has a tool whereby it can turn your phone and allow your phone to give diagnostic data to your doctor. Would you like to tell us a little bit more about that?
Absolutely. So what we, from the beginning, looked at mobile as a very powerful means to actually deliver better healthcare. So the powers that smartphones have these days and the power of AI and algorithms is way more than when we saw what is getting used and what is getting delivered, particularly in healthcare applications. Just using mobile for connectivity reasons, just to do a video call or something, is not going to really help that much. When you have doctor capacity problem, you need to do much more. You need to augment the capacity, right? So, and also you need to help the patient that it's always on with you. The mobile, it can help you in any situations, right? So we looked at it and we thought about it deeply. So what we've done is that we really use and we built algorithms with a lot of data that and machine learning on top. That we have built models where we can actually analyze just regular conversations of doctor and patient on the text, and while explaining their symptoms. We can analyze, for example, if you have cough, you can express, instead of expressing cough in a textual format, saying that I have a dry cough, wet cough, I seem to have this kind of a cough. You can just cough, and then we have built an AI model that actually classifies the type of possible types of cough that it is belonging to, and then it helps the doctor to come to a diagnosis quickly, and also it helps the patient to say that, okay, whether it seemed to be tougher, lower respiratory infection, or pneumonic, etc., or it is a general upper respiratory viral, or simply probably an allergic cough, etc. So it really assures people. It does early detection, early diagnosis in the same. So we are extending that acoustics processing capability to not only cough, but also many more areas like babies' cries, etc. We are experimenting with those things as well. We have done image processing and plus ML, where you can take a consumer grade image from your mobile phone camera of your skin, and we can classify into 14 types of what might be the root cause of this skin lesion, or a rash, or etc. So we launched just now on most of the Android phones. You can take the a video of your finger, and actually you can we can detect the oxygen saturation level in the blood. So what is happening with this is that, on the one hand side, these are innovative ways of doing things and turning mobile into a diagnostic and examination device, helping both doctors and the patients alike. On the other hand side, imagine the effect on the consumers, right? They don't need extra devices to be bought. It is as simple as using your smartphone, and suddenly you have the empowerment that you know about your health easily, right? So using all these technologies, we are building now what we call self-care, in terms of you can assess your heart health, you can assess your whether you are tending to have a diabetes or a pre-diabetic or diabetic, you can assess to whether you have a PCOD or you have hypothyroidism. So we're launching all of these self-care modules. In the end, if you assess your risk instantaneously, knowing about your health is the first step, right? After that, you can get the help by doing a video call, etc. And doctor also knows the assessment report, so he or she can take an informed decision as well. So we are doing all this in a holistic way, turning mobile into a kind of a companion for the patients, and a very knowledgeable assistant to the doctor. So that's the kind of two personalities that the mobile app, MFine app, is taking in the phones of the people, both on the doctors and on the patient side.
That's remarkable. I mean, if I can just reiterate for the viewers, essentially what Prasad is telling us here is that you can cough into your phone, and the phone will use its AI and machine learning algorithms to tell you if there is something wrong with the way you cough. It can take a photo of your finger and tell you your oxygen saturation levels and things of that nature. We are bordering quite plainly on almost a science fiction kind of space right now, where your phone is a mobile doctor, almost a robotic doctor. That is remarkable.
Yeah, at least a very good doctor's assistant or a health companion, right? I mean, just like these are good vitals, right? I mean, the oxygen saturation algorithms we are extending now to understand the heart rate, as well as we see a good possibility that we can also monitor with reasonable accuracy blood pressure, etc. So we will go through a very rigorous process of getting certification for these algorithms. We are in the process of that. We'll go through what is needed in healthcare, the rigor and the accuracy and the results. But the possibilities are immense.
Right.
And the good news is it's no longer fiction. It is the reality, right? I think, and that is the strength of the kind of adoption, mobile adoption India has. This is a huge opportunity to leapfrog any of the models that probably world over developed. we can make every mobile device a kind of as you said, a mobile doctor, or at least a good doctor's assistant that people can use themselves.
Right. How have, if I may ask, how have doctors received this kind of innovation, and how have doctors responded to your services which you have been offering, especially over the last year?
Yeah. So we have more than 4,000 doctors on the platform, and it's a growing number of doctors who are coming on board. They're welcoming this. They're welcoming this with open arms, right? There were, of course, a couple of issues of policy, gray areas, etc. A year ago, etc. Government responded pretty fast. You see the way telemedicine guidelines have been released. And you see the way actually, some of the things that National Digital Health Mission has been accelerated with a lot of initiative there, National Health ID project. All of these things are definitely giving certain level of comfort that the doctors also needed from a policy making as well. So doctors are taking it very well, and in fact they give us a lot of feedback to improve it further. They want to participate in this digitalization or digital revolution in the healthcare, and they see the benefits that simply their services can be available to more people, and more people in the need and in a timely manner. I don't think any doctor. We have seen how great these frontline healthcare workers were, and their service commendable last 1 year, and more, and always perhaps no doctor wants people waiting infinitely and not get the care while he or she is able to deliver. So the moment they get this efficiency, effectiveness, technology support, they definitely are lapping up.
Right, because you hear all these statistics, when Indian doctors and foreign doctors meet and they compare the number of patients that they deal with on a daily basis, the
Absolutely.
Indian doctors often end up dealing with 10 times as many patients as foreign doctors. Yes. So I can totally imagine how MFine and its services act as a force multiplier for doctors, helping them reach even more people.
Absolutely, absolutely.
Right.
So we have very heartening stories. Many of them. I don't think even one program like this would be sufficient. Like cases of pediatrician being available, as I said, at 10 o'clock in the night, treating a patient from very small village, 40 kilometers from a second tier town, in Andhra Pradesh. Being available instantly, and then actually, suggesting what to do and how to spend the night and how to monitor red flags. It's been immensely helpful for those parents who had no other option, with the nearest hospital being 40 kilometers away on a Sunday night to reach, right? So these are tens of thousands of cases, if not more, that are happening every day on MFine. I think, and doctors realize that this is a transformative tool for them to be able to help and reach their patients, and and of course patients are wrapping it up in a big way. As I said, nearly 2 million people have used MFine already. It's an inevitable kind of technology adoption and service that India needs, with the kind of skewed doctor-patient ratio, and it's an inevitable opportunity that we should all take it up and build on. And I hope that many companies, many innovations will happen along with us in this space.
Right. No doubt. I also want to talk about the last year. Since you spoke about adoption, in the last year I was reading that MFine has added 1 million users. It has increased its usage 10 times. So that just tells you the kind of need that was out there over the last year for services such as this, and of course for services that, there's no other way to put it, these services save lives. Like you said, every case study, every example is perhaps a life saved, or certainly someone helped immeasurably, relieving them from pain or some other condition. So could you just tell us how the COVID lockdown was for you, how you dealt with it, and how you perhaps thrived in it?
Yeah, I think it was obvious, right? I think health or illness wouldn't have, couldn't have been stopped in term completely, right? It's an essential service, right? Obviously, that's why the adoption has accelerated like multifold, right? What we saw on the one hand side, numbers speak for themselves, like 10x more doctor consultations, and the overall business itself has grown order of magnitude big. Even diagnostic tests and and everything, and the the thing is, what we thought the behavior change and the economics, whatever will play out over the next 3 years, all happened more or less in 9 months, right? Um, Both from the provider side and from the doctors and the hospital side, diagnostic center side, and as well from the on the patient side. And it is inevitable, right? So, and by the way, this growth is not that everybody had some issue of COVID-related issue or something like this. It is really because it is really across all specialties, because everybody wanted to have a safe mechanism to reach their doctor, and every doctor wanted a safe mechanism to serve their patients, right? That's the initial reaction when the lockdown happened, when the virus was at its peak of spread. Whereas later, everybody understood that this is far better for both doctors and patients, not just for convenience, of course, huge convenience. The more important thing is access, and more important thing is really data, digitization, etc., so that you can take effective decisions from the doctor's point of view. And these tools, like we had nearly 200,000 people use over a period of 2 months, just a 2 to 3 months, what we launched as a COVID self-assessment. People reported certain symptoms, their travel history, their other lifestyle history, etc. We're making it even more sophisticated with pulse oximetry integrated now. They did COVID assessments, and some of the high risk and medium risk guys could immediately go for with the suggestion that the tool has suggested, an antibody test, RT-PCR test to confirm this, or even a doctor consultation and visit to the doctor, etc. So it really opened possibilities and opened the imagination of people that this is the way perhaps healthcare services should have always been delivered, right?
Right.
When we needed to visit physically for a physical intervention like a surgery, etc. Obviously, we have some of the best hospitals, but there is no point in crowding those for everything. There's no point in waiting, fearing the crowd and fearing the inconvenience, or let's say procrastinating, etc. When you have this access simplified, people really used it, and that's what drives early detection. That's what drives better treatment, early treatment, so that complications are avoided, and in fact, even bigger financial burdens are avoided if you
Right.
actually do it, with this.
No doubt, no doubt. My last line of questioning to you will be about your future plans. Now, you have quite recently raised a Series B round of funding. The healthcare sector is, as such, the one that has been the most invested in over the last year. Most certainly, you have fairly large-scale plans. Would you like to tell us a little bit more about them?
Yeah. Yeah, fundamentally, I think we are now launching many services, many more services. So doing doctor consultations, etc., and diagnostic tests is already a foundation that we have. We really are launching this AI-assisted assisted self-care, where people can actually, both reach a doctor when they want, and at least take care of the first steps of care, right? Just the AI helps you to at least know the severity of the problem on its own, right? So that is something that we are launching. We will go deeper into mental health. We're going deeper into certain specialties, and making them, much more accessible, much more easy to tackle with, the growing burden of NCDs in the country, non-communicable diseases, and communicable diseases as well. So, and another important beyond this AI assistance is that the AI assistant itself, we are enhancing into chronic condition management. We have just launched a diabetes care program where people with pre-diabetes or diabetes can be managed to, reduce dependency on medication, both with the treatment protocols as well as lifestyle advices that and assistance that we can give. We have seen already good cases of where their sugar levels are coming down. They're having a better lifestyle. They're able to go down with their life in a much more better way than than earlier they were able to do. So a constant monitoring for diabetes and other chronic conditions, and then improvement from there to reduce the dependency on medication and to improve their general health and lifestyle. So those are the features that we are launching. We will be launching along with National Health ID adoption, records management for self. Right, you can have all your records whichever provider you've gone to, whatever conditions you have in one place, accessible very easily, just like in a very safe manner and private manner. With your consent only, others can have an access to this. So that's another consumer-friendly application that we are launching. That's called MFine.safe. So we are really thinking that we will leverage every possible digital technology like mobile, like AI, automation and digitization, and take it to the extreme so that consumers can avail and in general the management of these health becomes much more accessible, much more easier. We see that there are a lot of partners in this journey. We have, as I said, 600 hospitals today. Over the next couple of years, we want to add make a network of 5,000 hospitals or so, and 50,000 odd specialist doctors, be creating health hubs where even physical interventions can happen across 50 odd cities and be reachable for within the 100-200 kilometers radius of those 50 odd towns, cities. That's the kind of expansion plans we have. We think that everybody should be able to reach a healthcare service and avail a healthcare service the minute they need to, whether it's a diagnostic test, whether it's a doctor consultation. It should be everywhere. Easily accessible. I think technology can solve that distribution problem very, very effectively. And a microcosm of that is already done in MFine, and we proved it across 6 or 7 cities that we are already there, and able to serve the entire country from there as well. So that's huge plans, and we are really excited about building what might be the 21st century's healthcare delivery system. A cloud hospital, if you will, where people can instantly connect from their mobile app, from wherever they are, and in a timely manner get their healthcare service, or health issue addressed instantaneously. And that's our vision, and that's our kind of a mission that we are working on.
Right. So that's huge plans from a provider of frankly extraordinary services. The cloud hospital particularly caught my interest. Essentially, what Mr. Prasad Kompalli has told us about MFine is that it is trying to empower individual people to tend to their own healthcare needs by themselves as much as possible and not be at the mercy of various constraints that exist currently in the system, and probably have done for a very, very long time. I thank him a lot for joining us, Mr. Prasad Kompalli. We wish you the best of luck. While we are on this road to Aatmanirbharta, it is things like universal improvement in healthcare services that is probably going to drive a growth and expansion in the Indian economy. We have heard and we have read numerous statistics and accounts about how a healthier populace ends up delivering a lot more, and it ends up boosting growth in a way that many other stimuluses cannot manage. So we certainly hope that MFine scales newer heights in achieving this and empowering the citizens of this country in this respect. Thank you so much for joining us. Best of luck, and thank you, viewers.
Thank you. Thank you very much for having me today.